Good afternoon. I'm Jane Hoidn, the Principal Pharmacist for Patient Services at Aneurin Bevan University Health Board, and I welcome you all to this Learning at Lunch session regarding the recently published All Wales Self-Administration of Medicines Framework. During this session, we will discuss what self-administration of medicines is, the purpose of the framework, how to use the framework, benefits and challenges, and what the next steps are. Self-administration of medicines, or SAM, is a structured process that enables patients, or in some cases their parents or carers, to take responsibility for managing and administering their own medicines during an inpatient stay. This approach recognises that many patients already have established routines, understanding and competence in managing their medicines at home. There are many reasons why SAM is important. Firstly, it supports person-centred care by respecting patient autonomy and involving individuals as active partners in their treatment. Secondly, there is published evidence that SAM can improve adherence, safety, and health literacy by reinforcing patients' understanding of what they take, why they take it, and how to take it correctly. Thirdly, SAM supports continuity of care, reducing the risk of confusion of errors when patients transition from hospital back to home. From an organisational perspective, SAM can contribute to reduce medication errors related to unfamiliar administration, better discharge preparedness, and potentially fewer medicine-related readmissions. SAM also aligns with the broader NHS Wales strategic vision of pharmacy delivering a healthier Wales, and is part of the Safe Care Collaborative, focusing on empowering patients, improving safety, and delivering high-quality, value-based care. So why do we need a framework? I'm sure there are many individuals here today who have experience of SAM within their health boards and trusts over the past years. As part of the development of the framework, a short life working group with representatives from pharmacy and nursing across health boards and trusts was convened. This short life working group was able to draw on policies and documents from all the health boards and trusts and discuss how SAM was currently being utilised, if at all. From this review, it became clear that even though SAM practices were similar across the health boards and trusts, there was still a lot of variation, and SAM was not being implemented in a consistent manner. SAM tended to be focused on cohorts of patients in specific specialist areas, and governance and documentation were difficult to maintain. It was deemed to be very time-intensive with little reward. The All Wales SAM framework was developed by this short life working group, along with AWTTC and endorsed by the All Wales Medicine Strategy Group, to provide a consistent, standardised approach to self-administration of medicines across hospital settings in Wales. The framework responds to a long-standing challenge in inpatient care. Patients who competently manage their medicines at home often lose that autonomy when admitted to hospital, which can negatively affect confidence, adherence, and continuity of care. The overarching aim of the framework is to support safe, person-centred self-administration of medicines during hospital admission where clinically appropriate. It seeks to ensure that patients who are willing and able to self-administer can continue to do so in a structured, supported and risk-assessed manner. The scope of the framework includes adult and paediatric patients, as well as parents or carers who may support medicine administration, and applies across inpatient settings within NHS Wales. Importantly, the framework does not mandate self-administration for all patients. Instead, it emphasises choice, consent and clinical appropriateness. By aligning hospital practice more closely with how patients manage medicines at home, the framework supports wider NHS Wales priorities such as medicines optimisation, reduction of hospital-acquired deconditioning, improved health literacy and safer transitions of care at discharge. In practice, this framework provides a practical and strategic foundation for understanding why SAM matters, how it fits within national policy, and what it means for everyday clinical practice. So what is the assessment process and levels of self-administration? A central element of the All Wales SAM framework is the structured assessment process that underpins safe self-administration. The framework recommends that all patients are considered for SAM on admission, with assessment forming part of medicines reconciliation and early clinical review. Assessment should consider multiple factors including cognitive ability, physical dexterity, understanding of medicines, willingness to participate, and clinical risks associated with the medicines prescribed. Capacity and suitability are not static, so reassessment is required throughout the inpatient stay, particularly if a patient's condition changes. The framework describes graduated levels of SAM to allow flexibility and proportionality. At the lowest level, medicines continue to be administered by nursing staff, but with patient involvement and education. At an intermediate level, patients self-administer under supervision, allowing staff to observe technique, adherence, and understanding. At the highest level, patients self-administer independently with appropriate governance and monitoring. This stepped approach allows patients to progress safely and supports preparation for discharge. It also ensures that SAM can be adapted rather than discontinued if risks emerge. For multidisciplinary teams, the pathway provides clarity, reduces variation in practice, and reinforces that SAM is a dynamic process focused on safety, learning, and patient empowerment, rather than a single yes or no decision. So what are the multidisciplinary roles and patient responsibilities? The SAM framework places strong emphasis on multidisciplinary working and clear allocation of roles and responsibilities. Pharmacy professionals play a key role in medicines reconciliation, assessing whether patients manage medicines independently at home, checking the suitability of patients' own medicines, ensuring correct labelling, and providing counselling to support safe self-administration. Nursing staff are central to ongoing assessment, documentation of SAM level, monitoring adherence, and ensuring that medicines are stored securely in accordance with local policy. Medical staff continue to contribute by confirming clinical appropriateness, reviewing medicines that may be unsuitable for SAM, and supporting shared decision making. Patients themselves also have clearly defined responsibilities, including storing medicines safely, taking them exactly as prescribed, reporting missed doses or concerns, and returning to nurse administration if they feel unable to continue. Safety and clinical governance run throughout these roles. Secure storage, clear documentation, training, and escalation processes are all essential to minimise risk. By clearly outlining responsibilities, the framework reduces ambiguity, supports accountability, and promotes a shared culture of safety. Reflecting on how these roles work together in local settings can help identify gaps, training needs, and opportunities for improvement. So what about training and education? All Wales training and education resources are currently in development to support SAM. The Short Life Working Group is continuing to work closely with Health Education and Improvement Wales, AWTTC, and other stakeholders, including patient groups, to address the need for training and education and ensure it is fit for purpose. Organisations are then responsible for ensuring training frameworks and governance arrangements are in place when SAM is launched within their health board or trust. Governance and documentation. So whilst the framework provides overarching guidance regarding SAM, each health board and trust within NHS Wales is responsible for implementation and accepts responsibility of the risks involved in the provision of SAM and the liability where the relevant organisational procedure or policy is followed. To support this, a lead professional for SAM should be appointed and an executive lead will be nominated to have responsibility for the oversight of the organisational procedure or policy. The risks of not implementing SAM must be carefully considered, and failure to implement SAM may adversely affect patient outcomes, continuity of care, and may contribute to deconditioning. Documentation has always been an issue with SAM previously, and hospitals in Wales currently use a variety of documentation processes and tools. How local policies adopt this framework with respect to documentation will likely depend on availability and rollout of electronic prescribing and also the Welsh Nursing Care Record. The ideal is to have electronic documentation and move away from paper-based records. However, the principles of accurate and secure documentation and recording should apply to all systems used. So where do we go now? The Short Life Working Group will continue to work with health boards and trusts to support development of local policies, which can lead to pilots across Wales in different specialist areas. For example, paediatrics, mental health and ED departments. These will all present different challenges that must be identified and mitigated if SAM is to succeed. There will be ongoing feedback and collaboration to ensure learning from each other, and this will feed into the development of robust local policies. It's also extremely important that the public become aware that SAM is an option that can be utilised for themselves and their family members if they are admitted to hospital. So there will be an ongoing public campaign. Audit of the use of SAM and ongoing quality improvement will also be key to ensuring that SAM is a success in the future. So in conclusion, the All-Wales SAM framework highlights a range of benefits when self-administration is implemented appropriately. For patients, these include maintained independence, improved understanding of medicines, increased confidence, and smoother transitions from hospital to home. For services, SAM can support medicines optimization, reduce de-skilling, and contribute to safer discharges. However, the framework is equally clear about potential challenges and risks. These include medication errors if assessment is inadequate, fluctuating capacity, storage and security concerns, and the need for staff training and consistent documentation. The key message is that SAM is not suitable for every patient at every time, and that safety must always take precedence over autonomy. The framework encourages teams to view SAM as a flexible, patient-centered process rather than a rigid scheme. Key takeaways include the importance of assessing every patient, revisiting suitability regularly, using graduated levels of support, and fostering strong multidisciplinary collaboration. By embedding these principles into practice, teams can use SAM as a practical tool to improve patient experience, safety, and continuity of care across NHS Wales. Are there any questions?